already knew Nicola and her family before this latest admission. Nicola had been a patient on one of the wards before, as had a twin sister, and we'd had lengthy chats with Pat and Mum, who's a real advocate and real powerhouse when it comes to learning disability and autism care in this city. So we'd had long conversations before, and we knew of the family, and we received a referral that Nicola was in A&E, and so our service went down to see what the problem was with Nicola and how we could support her in the hospital on that occasion.
I went down to see Pat after our referral was received and spent time sitting with Pat, understanding why Pat and Nicola came into hospital. It was very evident that Nicola was rolling around in the bed, that she had pain, that she was upset. The family were hugely distressed because it was a change in environment. It was a very different presentation to what Nicola was being experiencing over the last few weeks. What I was able to do is sit down and spend time with Pat, understanding what had changed, what had gone on. My knowledge and expertise within dementia was important, but also it was very much about how I could gather the information and support our colleagues within the ED department. What Pat had told me was that 8 weeks prior to her coming into hospital, she had a tummy bug. That tummy bug seemed to be the beginning of the challenges and the difficulties within the day centre as well, and also at home. What we had learnt and discovered over those 8 weeks was that Nicola was finding it difficult to go to the toilet. She was finding it more difficult to eat. Her lots of habits, lots of kind of normalities within the household had changed, along with behaviour difficulties, and that might be screaming, shouting, which gave rise to a dementia journey kind of progressing. From our discussions, speaking with the consultants, Pat had also spoken to social services about the change in Nicola's presentation, and it was then agreed that a multidisciplinary team meeting would occur within the hospital. That consisted of social services, the day centre staff, the family, and also ourselves, along with the community learning disabilities team. And it was discussing Nicola's presentation, how the family were in crisis, how the day centre found the difficulties presented, and how can we move forward. What was agreed that she wouldn't move to a nursing home that dealt with challenging behaviour and progression of dementia, because the evidence told us that she had a physical health difficulty, and that needed to be dealt with initially before any changes or any move to a new area. The family took on board that, social services also, and there was a sense of relief from the family to say, actually, if we sort out her physical health, actually her mood, her behaviour and things would change. And that was very evident as she was admitted to the hospital, as we supported her on her journey within the hospital, going admitted to a ward, to working with the staff on the ward, looking at the reasonable adjustments that we needed to do within the hospital to support Pat and Nicola in a very strange environment.
Nicola received around 10 days of treatment to support with her constipation, using enemas and different stuff medically to help her. She became well, the constipation alleviated, and she went back home to a family home with a sister and a mum, and didn't go to the other place that was planned originally before we had the meeting. So for us as a learning disability service, it was a really, really positive story. Somebody comes in, we were able to look at what was happening physically, help and support her as a hospital with that physical health, be there to support and listen to and liaise with the family throughout to offer them our help. And in the end, that patient goes home well to where they wanted to go, with their family around them, knowing that they can come and use and speak to us at any time if they've got any further issues going on in the future.